Hey, it's Jessica DaMassa with WTF Health. I'm here at Giant Health, and joining me right now, I have Sabrine Elkhodr. She is a pharmacist, and she's also the founder of two different startups. We have Pharmhack, which does hackathons based on pharma stuff, and what was the other one? I'm so sorry. Docfluencer. I cannot remember that. Okay, so the reason I wanted to talk to you, though, Sabrine, was because we got into a conversation. You ran a session here about medical marijuana, and so I'm very curious about that particular aspect of the industry. You're a pharmacist, so it's interesting to get your perspective on that. So why talk about this? What's going on in this space that has you so intrigued?
So the medical cannabis space is really exploding it's been exploding over the last few years. And the reason for that is, first of all, there's just been a wave of public support around patients having access to medical cannabis. And that's been based on the many stories that we hear of, for example, kids that have epilepsy that isn't being controlled by any other medication, and they take cannabis oil and suddenly they're seizure free. So over the last few years, we've seen a real change in public perception around medical cannabis. And for the first time it's being accepted, or maybe not for the first time, historically it was accepted, but for the first time in recent years it's been accepted as a legitimate medical therapy pending more research.
Do you think, broad scale, there are obviously the early adopters who are like, yes, let's do this. They're not afraid of it. But do you think as far as mainstream goes here, the consumer market, I'm from California, so it's legal there, so it's different. And we're seeing how that's changing the market dynamics for not only medical marijuana, but also for just cannabis in general. How do you feel like the market is here in the UK for it? Even on the medical side, are they generally accepting beyond these early adopters, or is there more education that needs to take place? What do you think?
So I think there needs to be, first of all, I think we need to look at, if we just look at public perception, there needs to be a lot more work to be done in terms of changing people's perception around marijuana, and really that comes back to the culture. I think in the UK it's a far more conservative culture generally. People are a bit more afraid of, for example, cannabis as a recreational drug. We've only just legalized medical marijuana here, so I think recreational marijuana is still way off. So in terms of the public perception, there has been some progress, but I think there needs to be a lot more to be done on that front. From the doctor's perspective.
Yeah, I was going to say, and from the pharmacist's perspective.
So from the doctor's and pharmacist's perspective, if you look back at what medical professionals are trained on with regards to medical cannabis, there isn't actually that much. So I know that from personal experience, we barely touched cannabis when I was at university. We had a couple of slides on it, and that was it. And we're supposed to be the experts in drugs and pharmaceuticals. So there is a lot to be done in terms of educating medical professionals and health professionals generally, but I think that also comes back to the fact that there's a paucity of data around medical cannabis. There is a lot of data, but there isn't quite enough to inform guidelines, for example, and specifically in the UK, there needs to be a lot more work done in terms of educating prescribers who can now, as of this month, legally prescribe medical cannabis.
What kind of, even from your perspective, it's what kinds of research are you looking for? What types of things are you most interested in finding out about the potential for medical marijuana?
That's a really big question. Look, as I said, I think before anything can become a standard part of medical practice, there needs to be enough of an evidence base to support the guidelines that come out of that. And at the moment, like I said, there is some evidence, but there isn't enough. In terms of the kind of evidence we need, again, that's another big conversation, but some of the, I guess, main questions are, what are the medical effects? So what are the medical conditions that we can use marijuana for? And if we can use it for those conditions, what dosages should we be using? So the two active cannabinoids being THC and CBD, what's the ratio that we need to treat a certain condition? And then what are the effects going to be long term? Are there side effects? And if there are side effects, what are those? What do they look like in kids, for example, versus adults? So it's a huge area of research, and the research base is building up now.
It's exciting, and I love talking to you as a pharmacist because I think, like, oftentimes people, I mean, at least in the States, it's like a lot of times we talk to the pharmacist more than we'll actually talk to a care provider, because we'll actually like be in the moment and have lots of questions. Are you being asked any particular questions from people who are coming into the pharmacy about this, especially as it's like just about to become legalized for medical prescription use?
Yep. So I actually don't practice as a pharmacist in the UK. I'm registered in Australia, but it's an interesting question because when I was in Australia and I was practicing as a pharmacist in the pharmacy, we did get those questions, and we legalized cannabis earlier than the UK did, so we obviously started having that debate a bit earlier than is happening here. But we did have that. Those sorts of conversations, and to be honest, as of a few years ago when I was getting those questions, I still didn't have the experience and the understanding of medical cannabis, and I would argue that that's basically the case with all of my peers, or most of my peers, because it was still very new. So I hope that answers your question.
Yeah, it does. No, I know there's a dance party that is like basically evolved around us, but I promise everyone can still hear you. So if you can still hear me, we can keep going. I have one more question for you. With this research that you're talking about, and these questions that even when you were practicing in Australia as a pharmacist, that you were getting asked and that you were looking for answers for, like, who do you want to see step in? Like, is it really something like, there are a lot of startups in the U.S. that are tackling this space. There's the big pharmaceutical companies who have been like oddly quiet about this corner of the market. I mean, so if, like, in an ideal world, like who would you like to kind of see lead the thinking as this part of the market starts to expand?
To be honest, I actually would like to see medical professionals leading the conversation. And if we're looking specifically at medical cannabis versus recreational cannabis, I think it's a relevant kind of situation where you want the prescribers who are going to be handing out the medication and prescribing the medication to be leading that conversation, because ultimately they're going to be the experts in the delivery of cannabis. So I think, but that's ultimately going to come down to having a deeper understanding of medical cannabis, and that's really what we need to focus on right now. So I think at the core of the issue really it's getting more research done and translating that into guidance, which can then guide medical professionals. So it's not quite sure how to answer that question.
No, I think that was beautifully answered.
Yeah, so I think it's a combination of doctors and also researchers.
Very good. Well, I mean, it's so interesting that here we are at this like party right now, having this kind of conversation, even though it is medically themed. Yeah. Sabrine, I thank you so much for joining us and for sharing your perspective on this. Thanks so much. Thanks. I'm Jessica DaMassa with WTF Health here at this dance party that is Giant Health. Thanks for joining us.